Hello, everybody. My name is Omar Monajid, and I am a Canadian aspiring dental student. And as part of my journey, I wanted to learn more about the experiences of students from Texas A&M College of Dentistry. So throughout this video, I held interviews with students from multiple stages of their education, ranging from D3s, D4s, an actual dentist who has just recently graduated, and another applicant who has just recently been interviewed. So my goal in this video is to just gather some insights about campus life, about the clinical aspect, and just some general information for prospective applicants like myself. So without further ado, let's get started.
My name is Nash. I'm a fourth year dental student at Texas A&M College of Dentistry. So it depends on the person. It really does. What their version of balance is.
Uh-huh.
Um, for me personally, I grind hard like the first couple of exams so that my grades are good to go. And so I can kind of ease off of the gas a little bit, so to speak. Might not work for everyone, but it worked for me.
I feel like once you graduate, you're basically like ready to treat patients.
Oh, 100%. I mean, it's again case by case, person by person, but me personally, I feel ready to go out there like with a solid foundation and pretty much a little bit of everything to start learning how to be better at treating patients. Like yeah, I'll have a solid foundation, and as a new dentist, I still have a lot to learn kind of deal.
100%, yeah.
And so at Texas A&M, it's like a clinically, it's like a partner system. So like a third year and a fourth year are partnered up together.
Oh, nice.
And so for
Sounds
me,
good.
I had like a super amazing fourth year partner last year,
Uh-huh.
and he didn't want to specialize, but he was like a go-getter kind of guy, and he just wanted to, always have everything done early. He was like super type A, but me, I'm like super chill. So I'm like,
Yeah.
our personalities definitely clash at the beginning, but we got into our groove. One piece of advice that I would give myself when I was a D1 is to uh, learn how to study early on. Like, pick a method and stick with it and get really good at it, and not like flip-flop around and like, oh, maybe I'm gonna try like Quizlet here and then maybe try Anki here, or maybe I'm gonna like do three passes here. Like, no, dude, just pick a method, stick with it, get really good with it. Because eventually I got just really good at using Anki. That's usually what I use,
Yeah.
spaced repetition and everything. So, and I make my own flashcards. So,
Really?
I found my groove, but that was like later on towards the
Mm.
end of D1. I was like, man, why didn't I do this earlier? Soft skills are kind of what I'm focusing on right now,
Okay.
on how to talk to patients, how
Yeah,
to, just treat them like a human being because they are.
for sure.
They're in my chair. I'm responsible for taking care of their dental health kind of deal, and so I should be able to strike up a conversation with them
Yeah,
about literally anything. And so
exactly.
just to be able to do that and just to connect on that level as like human to human, I feel like dentistry
That's amazing. Yeah.
provides that like as a career choice. Yeah, like I just love yapping with people, honestly.
All right, Nash, my last question is what's the biggest advice you would give me or like any prospective students that is wants to go to Texas A&M,
Make sure your heart's in the right place, honestly.
right? Passion?
Yeah. Yeah, yeah. Honestly, dentistry was not my first choice because, exercise science major whenever I
Uh-huh.
was an undergrad. I wanted to do physical therapy, but then like I did a lot of soul searching, looked inside, and I'm like, you know what? Maybe I don't really want to do that. And then so before hopping fully into dentistry, make sure you shadow,
Uh-huh.
see the good, the bad, the ugly of dentistry and talk to people like you're doing right now. Ask people like their honest opinion, like, hey, how do you like dentistry? How do you like school? And just be immersed in dentistry kind of deal. In person, just go to different offices, see how they're run. Go to not just private offices, but also some corporate offices. Go to public health clinics and just see what all is out there and think to yourself, is this for me? Do I see myself doing this 5, 10, 15, 20 years down the line?
Yeah. So I'm Heydi Vanegas. I am a D3 at Texas A&M. School of Dentistry. So the funny thing is when I discovered, well, when I found out I wanted to be a dentist, I went on Google and I was like, how do you become a dentist? And it said go to dental school. So then I was like, dental school's near me. And so I looked up this school and at the time it was called Texas A&M Baylor still. And so I'm from Denton, which is like 40 minutes north of Dallas. And so Dallas has always been really close to me. My family, like kind of like you, my family is super close. And so it felt like a perfect place because I love Dallas. I love the city. And so I feel like that plus doing a summer program as a pre-dental at the school
Uh-huh.
really kind of made me like the school a lot more just because I got to know the faculty and I got to know the school before even being a student too. So I'll start with like campus life because it's a lot different than undergrad. There's not really necessarily a campus life. It's just kind of like you see your classmates in passing and there will be socials outside of like school hours or they'll have like little things during lunch. But really it's just kind of you find your people and if you want to go do something, you'll go do something.
Hmm.
But they do like a few things. Like we just recently yesterday had a little like ASDA field day almost. So that was like a thing for the school. So that counts for like, I guess, campus life.
Hmm.
Um, in terms of like balancing your life, I'm like a number one advocate for like work-life balance just because D1, I failed at doing that. I was just like studying all day after being at school all day. And so I was miserable. I wasn't doing anything except studying and I was down bad. And so I feel like after I kind of got a hang of like what study methods work for me, I started to make time for myself. Like it started with like just an extra hour to go to the gym and then, let's just balance our studying today and go out later. So I feel like everything in moderation is possible. I think the first year will be the hardest and you'll have to sacrifice a little bit of your personal life, but that's
Hmm.
almost pretty much everybody.
For sure, yeah.
But after that, like it really is a lot better. It's not smooth sailing, but it's a lot better. Like I have so much time to just kind of do whatever I need to as long as I'm keeping up with my stuff.
That's amazing.
So right now, since we started in June, we've only done like whatever we've been able to like whatever comes in, I guess.
Hmm.
So like at A&M, we have like a buddy system in clinic, and basically as a D3, you get partnered with a D4.
Okay.
And I feel like D3 is kind of a little bit of like glorified assisting for a little bit because you really just
You're
like
still
sit
learning,
there.
right?
Yeah, I guess like you kind of just assist your partner sometimes with like suctioning or like whatever they need. And like,
Okay.
I guess it's good to watch, but I personally like bring my own patients in because you're allowed to do that.
Oh, really?
I feel like yeah, it's a lot easier. The school does give you patients, but like it's like one every like couple of weeks. It's not always consistent
Uh,
because they have to give like patients to everybody, like all the D4s
yeah, for
first.
sure. Yeah.
And so, because I'm from the area, I found it a lot easier to just bring people over because they're like 40 minutes away and they're willing to come. And so that's where I've been getting a lot of practice in because I bring my own patients. Um, I would say right now it's kind of a slow start. I've only really done, well, I've done extractions and fillings and stuff like that, but it's definitely slow. Like let's say for endo, I definitely wouldn't feel ready for endo. I haven't done anything for endo.
Mhm.
Um, Most people who graduate from A&M only graduate with like maybe two endos procedures.
Okay, I see.
So that's kind of like a downside. But I feel like right now, since I did just start, there's not that much I have done. I have classmates who have done a crown already, but it really just depends on like how lucky you are of with what your patient
I see.
needs. I would find a good study method that doesn't involve rewriting your notes.
Yeah.
Find something solid that works and is consistently working. Because I was the type of person that would like rewrite all of her notes and like I would do it a lot.
It
And that
took too
helped
much
me because
time,
I'm
right?
good at that. But yeah, but like I went from taking like 13 credits a semester at my college to 25, 26 a
Oh,
semester
wow.
in dental
Yeah.
school. So like it's not feasible anymore. And I was just struggling and I was like not doing well for a while because I couldn't figure out how to study. So
Hmm.
if you go in with a method that is solid that you know can like be like 25-hour, it can still work for that like drastic change in credit hours. I would do so. Like Anki has become like my best friend.
Yeah.
I love Anki, get a remote, different things like that, just because you have to maximize your time.
Before we get started, can you just briefly introduce yourself?
Yeah, for sure. My name's Mohammed Bleible. I'm 20 years old and I am now applying to dental schools and I attend the University of Detroit Mercy and I'm currently a senior completing a bachelor's in biology. So, being a Texas resident and having family in Texas, I have a very strong support system in Dallas. And Texas A&M specifically stood out to me because I have a lot of family members who have actually graduated from the School of Dental Medicine at Texas A&M, and I've only heard positive things about their experiences through the school. Another thing that I really like is the location of the school, seeing how it's in downtown Dallas. I love the city of Dallas and I've visited it a few times, and I really would could see myself living there and making lifelong friends in that area.
How did your interview go, and what do you think of the campus?
So I've interviewed at a few different dental schools as of now, and my favorite dental interview was definitely the interview at Texas A&M, mainly because of the atmosphere that the school provided. Talking to the different students that I interviewed with and the different faculty members at the school and the students attending, it really felt like everyone was very encouraging, and that's the atmosphere that I would like to surround myself within as I work my way through dental school. Something that I really enjoyed about the interview was having a short talk with Dr. Spence where she interviewed me. Instead of feeling like I was on the spot and I had to answer all these questions, it was a very conversational interview where
Hmm.
I felt like we were kind of talking with each other. It didn't really feel like an interview setting. Rather, she was just trying to get to know me better, which I found very interesting as it hasn't been the same in the other places that I've interviewed at.
If you do get accepted, what is the one thing that you look forward to the most?
So, coming from a smaller university like the University of Detroit Mercy, I'm used to having smaller class sizes and having really close relationship with all my peers and faculty members. And I hope to continue this as I enter dental school at Texas A&M, as I would love to have a family and a backing at the School of Texas A&M.
Hello, Dr. Omar, how are you doing?
Alhamdulillah, I'm doing well. How about yourself?
I'm very good, thank you. Can you just give us a brief introduction of yourself?
So my name is Omar Dahshi. I am a graduate of Texas A&M Dental School in 2024. I graduated from the Ohio State University prior to that in 2020, with a bachelor's in medical laboratory sciences. So I had a little bit of background in hospital-based care. And then finished in last year in 2024 with my dental degree.
Clinically speaking, do you feel like you were prepared when you left dental school?
Clinically speaking, so my personal situation was a little bit different, or at least my class, I should say. So we were post-COVID, very shortly post-COVID. So when I graduated 2020, um, COVID was still in its peak. So clinical dentistry in schools was at a drop nationwide, like
Yeah.
everybody nationwide,
Mhm.
big drop in experience for third and fourth year dental students when I first started dental school. Now, when I got into the school clinic, my experience in the preclinical, was less so than my predecessors.
Mhm.
But the exams were the same, the tests were the same, nothing really changed on that end. So we still got that experience in the preclinical lab in the first 2 years. What I will say A&M was unique with over other schools was that they still have the old school type of teaching when it comes to
Yeah,
dentistry.
yeah.
So they used to teach us how to do casting, wax ups. We cast a whole crown from scratch. We did a wax up. We poured it up and made the crown from complete scratch. A lot
Mhm.
of schools kind of took that out of the curriculums just because it's no longer really done in the real world. You're gonna mostly send it to a lab,
Yeah.
and you're not gonna do all these things yourself. But A&M was still teaching the dental students the way that the professors used to do it when they were in school, in the 80s and the 70s. Because we do have professors who graduated in 1974
Really?
and 1980s, but they're still teaching at the university. So they're still teaching us in that old school method, which is good because once when push comes to shove in real world dentistry,
You can
and you
do it
get a bad
yourself.
crown or something in the lab work was off, you can troubleshoot it because you've had that kind of background in that
Exactly.
training. So that in that aspect you were stronger than others.
So, obviously, from multiple students, everyone tells me their different experiences and different paths. So, what would you say from your experience at Texas A&M kind of set the school apart that prepared you to become a dentist?
I'll say the what set my school apart specifically for the year that I joined is that there was a change in curriculum. So we were I was the second class to experience this curriculum change. The class above me was the first. And in that process, they were trying to switch out from part ones and two boards, switching out to the integrated board. So they tried to train, switch out their classes to, move things around to try to accommodate for that new style of board exams. So it was a little bit of a struggle. My personal experience was that it was a little bit of a struggle to try to balance between adapting to dental
Yeah.
school and the changes to, and the type of studying, the studies, the everything about dental school, and trying to work with the school. And obviously, the school is going to have their mistakes, their hiccups here and there with the curriculum change. So we
Yeah.
were trying to work with them as well. And what that experience taught me in the 4 years that I was there is anywhere you go, any work environment you're going to go to, whether it's dental school, whether your job, you're always going to face struggles and challenges of different types that that are not necessarily related to your field of work. It's not dental related. It could be administrative related, or work, your teamwork related,
Yeah. Yeah.
co-workers, your professors, your faculty. All of those struggles are outside of your personal struggle in the field itself, whether skill set wise or academia wise. That experience really kind of opened my eyes to the real world and the reality that we live in which, the struggles aren't always limited to books and skill sets. The struggles are multidimensional, and you just have to adapt and work with what you have in any situation that you're in.
Last question.
Yeah.
So, if you were to give advice to me as a prospective applicant, like
Mhm.
trying to follow your footsteps and become a dentist and graduate, what would you say?
I'll say this: go into dental school, and don't let any struggle that comes in your way hit you and crash you down. You're going to run into a lot of struggles in dental
For
school
sure.
and outside of dental
Mhm.
school. And each struggle is going to be different, and it's going to feel unique to you. Like you and your classmates, we all had different struggles. I had a classmate who broke her hand in dental school, and then she couldn't do her licensing exam with her hand,
Really?
but she made it work, and she worked with her other hand and practiced with that. And then alhamdulillah, she finished, graduated, and now she's working. Some of us had family members that passed away,
Mhm.
and that kind of was, big hit in their journey.
Life
Um,
happens, right?
your life happens, and you're gonna run into struggles in dental school. I failed an exam in dental school. Some people had to redo a year, um, and like you're gonna feel like, oh, I'm not. This is not for me. I can't do this anymore. But everyone's gonna have a different struggle. Don't feel isolated in that sense. You're gonna have a struggle unique to you, just like everyone else in your class is gonna have struggles unique to
Mhm.
them. Live your life in the moment that you're at. Don't look at uh
Don't think you should
graduation
all
or
look back.
after, because if you keep looking forward, you're always going to regret your moment, and you're always going to hate the moment you're in. And then reality is you just need to live every single moment you're in and work on it. And yeah, don't let the hard times crash you down and make you give up. And you'll live a much more satisfied life in that
That's a
situation.
very good motivational quote to end it off.